Hi, I'm Rich Daly, and this is Fast Finance, your quick hit of the news and numbers that matter in healthcare finance. Up first, weird numbers. These are some random healthcare numbers that recently caught our eye. Today's weird number is 40%. That's how much higher the year-to-date bad debt and charity care per day are for hospitals compared to their year-to-date amount in 2022. That's according to the latest Kaufman Hall Hospital Flash Report, which uses Strata Decision Support data. And that latest surge is not just an increase across all metrics from COVID lows, since that increase also outstripped the increases in both inpatient and outpatient revenue per day during the same comparison timeframe. Now for today's main story. A range of alleged financial damages against hospitals and health systems underpins the recent anti-competitive lawsuit by Texas against dominant electronic health record vendor Epic. The December 10th lawsuit against Epic by the Texas Attorney General details a long list of financial and other harms the company's practices allegedly have inflicted on health systems.
When your market share starts to grow, you become more of a target. I think that's just a natural thing. So that as Epic has grown its market share, and frankly, the cost of these systems is enormous. So people are thinking about lots of different things about that. And I said, is there something that's abnormal about that? Or is that just, what should be, and we have to get used to the reality?
That was Colin Zick, partner and chair of the Foley Hogg Healthcare Compliance Practice. He said the financial significance of EHRs for health systems underscores the importance of the case for executives.
It definitely bears watching because it's part of, ultimately your EHR is going to be one of your most significant expenditures. And so you want to understand what's going on in the marketplace, not just what products are available. Well, what are the terms that you can get? That's another nice thing. If you read this, you see a discussion of Epic, its conduct in the marketplace, its terms. That's valuable information that may not have been that easy to get. So I would say that for folks in management positions in hospitals, this complaint is required reading.
Epic responded to the lawsuit with a written statement that said in part, the lawsuit is flawed and misguided by its failure to understand both Epic's business model and position in the market, and the enormous contributions our company has made to our nation's healthcare system, illustrated by products like MyChart, software that tens of millions of Americans depend on every day. The lawsuit marks the third major case filed in 2025 against Epic. Earlier this year, Particle Health filed a federal lawsuit that accused Epic of leveraging market power to restrict patient data access. A federal judge rejected Epic's request to toss that case, and it is proceeding into the discovery phase. Additionally, a lawsuit by Cures Health alleges Epic used market dominance to block innovation. If Texas's lawsuit is successful, Zick expected other states to undertake their own such lawsuits.
If there is a successful type of case being brought by one attorney general, others tend to pick that up and say, I should do that too, because they're onto something. That's a normal thing to see in law enforcement. So I think it is something that could be setting a model here. And it's also possible that Epic could look at this and say, okay, there's some things we need to do so that we're not as exposed to suits like this. And they could change some of their contract language, for example, going forward, some of their contracting policies, and be able to say, look, you're looking at stuff in the past, we've evolved, and make themselves a bit of a moving target, which would be harder for the Attorney General to land on.
Given the massive dollar amounts involved in EHRs, generally, the lawsuit bears careful watching by health systems. And now before we go, just one more thing. HHS immediately appealed a judge's recent decision to halt the 340B rebate model, which had been set to launch on January 1st. That appeal went to the First Circuit Court of Appeals, which declined to immediately lift the pause, though it indicated it would rule quickly. The appeal followed the December 29th decision by Judge Lance Walker to grant a preliminary injunction sought by the American Hospital Association and other hospital groups. The injunction was based on the judge finding the Health Resources and Services Administration likely violated federal law by not adequately considering the financial impact on hospitals, which rely on upfront discounts from the 340B program, and HRSA failed to provide sufficient documentation for the pilot's rollout. Even if the current injunction is lifted, the lower court could still invalidate the pilot, or HRSA could revise and re-implement it in order to address the federal rulemaking concerns raised by the court. That's all we've got for today. Don't forget, you can get the Fast Finance newsletter delivered right to your inbox every Wednesday. Sign up info is in the show notes below, or you can go to hfma.org. I'm Rich Daly. Thanks for listening.